Good morning. We'll go ahead and get started. Thank you for joining us for our Northern Light Health Good Health is Good Business conference. Over the next hour, we will delve into the topic of chronic pain and disease management. The CDC defines chronic disease as conditions that last 1 year or more and require ongoing medical attention and or limit activities of daily living. And while many chronic conditions are considered preventable, chronic diseases remain the leading cause of illness, disability, and death in the United States. Many of us on the call today are impacted by a chronic disease or chronic pain, or certainly we have loved ones or colleagues who are. Today, you will learn some of the strategies used within the healthcare industry to better support patients' management of chronic disease, and you will hear about the connection between chronic pain and mental health. We are also excited to learn about effective strategies for self-management, as well as community-based resources and programs right here in Maine that are available to support patients on their journey to better health. So thank you for being here, and we look forward to an engaging and informative conference. I'm Karen Hawks, Vice President of Operations for Population Health at Northern Light Health, and I'll be your moderator for the next hour. Please join me in welcoming today's panelists. We have Brianna Colville, Ambulatory Care Pharmacist Lead at Northern Light Mercy Hospital, Dr. Kristen Sparks, a psychiatrist for consult services at Northern Light Acadia Hospital, and Melissa Emmons, Community Programs Coordinator for the Peter Alfond Prevention and Healthy Living Center at Maine General Medical Center. Before we get started with today's panel discussion, I will read our legal disclosure. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. And Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. This hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. We also want your feedback. I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. So with that said, it is now my pleasure to welcome Bree Colville to present. Bree will share some insights into the healthcare industry system and the role pharmacists play to support patients' management of chronic disease. So thank you, Bree, for joining us.
Good morning. Thank you for having me. So like Karen so nicely said, my name is Bree Colville, and I work as an ambulatory care pharmacist at Northern Light Mercy. And today I want to talk about the role that ambulatory care pharmacists play in chronic disease management. So we'll start out with talking about some of the U.S. healthcare system challenges. So the U.S. healthcare system is the most expensive in the world. Our healthcare costs account for 17% of gross domestic product, and there's a lot of wasteful spending. We have excessive administrative costs, preventable emergency department and hospital visits, poorly controlled chronic conditions, and low value and duplicative services. This wasteful spending is estimated to be at about $3,500 per person. And despite that really high level of spending, our quality is just not there. In 2014 and 2017, the Commonwealth Fund conducted research comparing the quality of U.S. healthcare with 11 other major industrialized countries in the world. And in both 2014 and 2017, the U.S. ranked last. So in 2007, the Institute of Healthcare Improvement launched the Triple Aim, which lays out a framework describing an approach to optimize health system performance. It's focusing on improving patient experience, improving the quality of care while reducing the cost of healthcare. And this Triple Aim has really created a dynamic shift in the way patient care is provided. It's encouraged interprofessional collaboration for optimal chronic disease management. It's said now that providers need to work 27 hours a day in primary care to meet all care needs per guidelines of a typical patient panel. You couple that with a predicted shortage of providers, and it's a perfect storm for burnout, which is a really popular topic right now in healthcare as well. Some even consider it to be a quadruple aim, with that fourth really looking to decrease healthcare workers' burnout. There's also been a shift in payment models from our traditional fee-for-service model to value-based or alternative payment models. So our fee-for-service is based on the number of services provided. Focus is really just on quantity, does not factor in the quality of care or patient outcomes. Versus our value-based is moving towards rewarding the value of services, payments based on quality of the care provided over quantity. And this actually can bring down the price of care for individual patients, as well as improve patient satisfaction and health outcomes.
Bree, this is Karen. We
Yeah.
have a couple of comments about the volume of your voice. I don't know if you have another microphone option or if maybe you just speak up, but
Yeah, let me see.
we can play around. This is we're all used
If I move my hair out of the way, is it easier for folks to hear me?
a little bit, but maybe just speak up. I will let the audience know Brianna is covering from an illness, so her voice is also, she's struggling with that too. So sorry, Bree, but thank you.
No, I'll try to speak louder.
That's better.
Sorry, everyone. So medication-related problems is also an issue in the US. So adverse events, drug interactions, and medication non-adherence all increase healthcare costs. So 70% of all medical visits involve drug therapy, and 22.4% of the population takes 5 or more chronic medications. The money spent on prescription drugs in 2021 was $603 billion, and the cost of drug-related morbidity and mortality is approximately $200 billion annually. So we're talking about a lot of money. And appropriate medication use is complicated by the aging population, the burden of chronic disease, and the projected shortage of primary care providers. This figure on the right is looking at that increasing population of those 65 and over. And we know this is especially true in Maine, where our population is much older. So how can ambulatory care pharmacists help? I think it's still very common for when people hear about the job of a pharmacist that they think of their pharmacist at the Walgreens pharmacy behind the counter filling prescriptions. And the job of an ambulatory care pharmacist is new to folks. I still have a lot of patients who come in to see me in the primary care practice I work at and are shocked that they're seeing a pharmacist in an exam room in a provider's office. But there's a lot that ambulatory care pharmacists can do in that setting. And just some of those services include medication management services, patient education and self-management, immunization screening and administration, providing drug information, performing medication reconciliations, doing these services either face-to-face or via telehealth, helping with the coordination of care for patients, being advocates for patients, providing education to our fellow healthcare providers and medical office staff, helping with transitions of care, performing annual wellness visits and group visits, doing comprehensive medication reviews, increasing patient adherence with their medications and healthcare, preventative care, wellness screenings, doing shared visits with other healthcare providers, performing prospective or retrospective chart reviews, and refill authorization. And again, this is just some of the services that we can do as ambulatory care pharmacists. So I wanted to dive in a little bit deeper about the comprehensive medication management piece. So depending on what state a pharmacist practices in, they may have an expanded scope of practice. So most states allow pharmacists to work under collaborative practice agreements. Maine is one of those states. So this is an agreement that enables providers to delegate specific tasks to pharmacists. So these can be things such as initiating, adjusting, discontinuing medications, ordering and monitoring lab studies, and performing limited physical assessments. In some states, ambulatory care pharmacists can even serve patients as advanced practice pharmacists, clinical pharmacist practitioners, or pharmacist clinicians. And these are really great ways for ambulatory care pharmacists to help with chronic disease management. So some of the diseases these can be helpful for are things like hypertension, hyperlipidemia, diabetes, COPD, heart failure, osteoporosis, anticoagulation, chronic kidney disease, hepatitis C, mental health, pain management. And again, just naming some of those chronic diseases that pharmacists can help with. Where can pharmacists provide these services? All sorts of places. So again, myself, I'm embedded right into a primary care clinic. So patients schedule right at that clinic to see myself just like they would their primary care provider. Pharmacists can also be located in accountable care organizations, VA centers, community-based or free clinics, rural health centers, self-insured employer clinics, all sorts of places. So kind of applying what we've talked about. So for an example, a family medicine provider refers a patient to an ambulatory care pharmacist for co-management of their type 2 diabetes. So the pharmacist can review the patient's blood glucose readings and assess their current glycemic control. They can initiate, adjust, and/or discontinue oral and injectable meds for diabetes. They can order and interpret labs, for example, like a hemoglobin A1C, a basic metabolic panel, a lipid panel, a urine microalbumin. They can measure blood pressure and heart rate, and then initiate, adjust, or discontinue therapy to reach therapeutic goals for that. They can conduct a cardiovascular disease risk assessment and initiate statin therapy as appropriate. They can perform a diabetic foot exam, provide education on meds, glucometers, hypoglycemia, diet, and exercise, review all medications for appropriateness and evaluate for drug-drug interactions. They can ensure patients have access to affordable medications. This is a really big piece that pharmacists can help with too, and help an entire practice with. It's a huge reason that patients aren't adherent to medications, as many medications are extremely expensive. And pharmacists can also recommend and administer immunizations such as influenza and pneumococcal vaccines. So to wrap it all up, some key takeaways are that pharmacists can develop, implement, and evaluate quality initiatives that improve the health of populations with chronic diseases. Pharmacists can also help support this triple aim. So pharmacists can increase patient satisfaction through addressing patients' questions and concerns regarding their medications, acknowledging a patient's unique medication experience. I find a lot in my role, it's addressing hesitancy to medications or providing motivational interviewing to help patients see these medications as tools to help them live their life as they wish to. Providing longitudinal support to patients and increasing access to healthcare. At the clinic I work at, I help to do more frequent touch bases with patients, allowing them to go longer intervals between seeing their primary primary care provider. So this opens up appointments with the primary care provider for other patients while still providing all those patients with access to someone at the office to see someone to reach out with questions. Pharmacists also increase the quality of care. They can help pharmacies or practices achieve quality metrics, which can then enhance reimbursement through pay-for-performance measures. And when pharmacists manage patients with chronic diseases, providers can then dedicate more time to the diagnostic and treatment selection process. It said for every 10 patient visits with a clinical pharmacist, that 8.2 provider visits are avoided. And it also helps reduce staff burnout. A lot of providers really like having a pharmacist on the team. Pharmacists can also reduce the total cost of care. So by reducing hospital admissions, unnecessary meds, emergency department visits. The Asheville Project demonstrated that pharmacists who cared for City of Asheville employees with diabetes improved patient satisfaction with their healthcare, decreased healthcare costs, and increased the number of patients who achieved hemoglobin A1C, lipid, and blood pressure goals. They found a decrease in total direct medical costs ranging from about $1,600 to $3,300 per patient per year, and a 50% decrease in sick days. Overall, adding a pharmacist to the team can help you see better outcomes.
Thanks so much, Bree. It is amazing how the profession has evolved to really meet the need and to open up access for patients and for those who need that extra support. So thank you so much for that insight. We will be welcoming Bree back at the end of our segment to answer the questions. So again, please ask your questions using the chat box or the question and answer feature. We'll be sure to get to those at the tail end of our hour today. But it's now my pleasure to welcome Dr. Sparks to present on the connection between chronic pain and mental health. So thanks so much for joining us, Kristen.
Well, thank you. I'm pleased to be here. Pleased to be with the two panelists. I love the setup and kind of the way this all integrates together. So thank you all for being here with us. I'm Kristen Sparks. I'm a psychiatrist and work for the Acadia Consult Service, which sees folks generally in the ED setting or in the inpatient setting. So I'm talking about chronic pain and mental health today, but it could work also with chronic illnesses in general. And I loved when I was preparing for this, found this cartoon. I love this. The adage is, if whatever doesn't kill you makes you stronger. And so I love the idea of, dear, whatever is killing me, I'm strong enough already. So thanks, you can leave now. And I've thought about this a lot over the last week. I think that applies to just general adulting kind of every day. I have these similar thoughts, but imagine if you're dealing with chronic pain and mental illness, that feeling can be overwhelming. Like how much is too much? So I looked at a lot of data around kind of the co-occurrence of chronic pain in particular and mental illness, particularly anxiety and depression. And there are lots of numbers, lots of statistics I had in here, but then I found this graphic, and I think this really summarizes it the best. And you can see the large chunk of people that struggle with both chronic pain, that's CP on this graphic, and anxiety or depression. So in chronic pain, the estimates vary, but they're anywhere from kind of 25% to 45% of people will have an anxiety or depression diagnosis as well at some point, along with their chronic pain diagnosis. So it's a huge chunk of folks that are struggling with both of those. And I think we do them a disservice to, if I'm as a psychiatrist treating anxiety or depression, to overlook the chronic pain piece. And likewise, if we're treating chronic pain condition, to overlook the anxiety and depression that has a high probability of being there. So I guess the question is why? I mean, it doesn't feel surprising that folks with chronic pain have more anxiety and depression diagnoses. But what are some of the reasons for this? We do know that it's a bidirectional relationship, right? So if you have depression or anxiety, you have an increased risk of developing a chronic pain syndrome or a chronic pain diagnosis. And if you have chronic pain, you have an increased risk of developing depression or anxiety. Again, there are some fairly straightforward and clear reasons for this. So pain can impact your sleep, it can impact your function, your mood, which increases the susceptibility to mental illness. Likewise, mental illness can amplify your perception of pain so that your pain feels worse than it would be if you didn't have a depression or anxiety diagnosis. There are some biological reasons for this. So there are areas of the brain that are shared in terms of both pain and mental health. And there are neurotransmitters that are shared in terms of pain and mental health, like serotonin, norepinephrine. And there are also overlapping symptoms in these syndromes. So for sleep is a typical complaint both of chronic pain and of depression, anxiety. So there's a lot of overlap just in the brain, in the symptomatology. And again, it goes in both directions. One influences the other. So then what do you do? What to do about this? This is my last comic, I promise. I love this idea because I see folks in the emergency room, and I think this situation plays out every day in emergency rooms all over Maine and all over the United States. So the provider's asking the patient, do you have any psychological issues? And her internal monologue is, well, I have chronic pain, so I'm obviously depressed, which we just talked about. But if I tell you that, you probably won't treat my physical pain or take my physical pain seriously. So she says, no. They say, are you sure? Oh, very much. And I think this is the difficulty that patients often run into when they're seeking help. They know that something's not working, and how much do you reveal? And the problem is, if a patient comes to me and I'm seeing them and they talk about their depression, anxiety, they're worried I'm going to overlook their chronic pain. If they go trying to get relief from their chronic pain, their depression and anxiety can often be overlooked. Fortunately, there is some clear evidence around this. So in terms of what to do, practically speaking, you absolutely have to treat the mental illness. So unlike that cartoon where the patient was not interested in disclosing kind of the depression, the evidence is actually that if we treat the depression and anxiety, we improve pain outcomes. The flip side of that is interestingly not true. So if you treat someone's chronic pain, you don't necessarily improve their depression and anxiety. This is not data-based, this is just experience-based, but it makes sense to me intuitively because depression and anxiety can often stem from situational factors. But once they kind of catch hold, they sort of take on a life of their own. So once you're in a major depressive episode, even if it was related to understandable and real conditions like the death of a spouse, once you're in that episode, it has a life of its own, and that episode itself needs to be treated. It just is not a matter of changing other factors. So that's the first thing. And how do we treat the mental health conditions? Patients hate it when I say this, like exercise and diet. I start with that. Exercise has so much evidence in treating mental health conditions, depression, anxiety, and others, that it's, the example I give folks is that in somebody with major depression, starting an antidepressant, a typical antidepressant, versus starting an exercise program have equivalent outcomes on a population basis. So it is absolutely a thing that we know helps in mental health. The caveat is in chronic pain. So in fibromyalgia, there's a lot of good evidence that exercise improves outcomes, improves the pain outcomes. But depending on the source of pain, and this would be true for chronic conditions as well, depending on what the chronic condition is, of course, they're going to have to discuss with their provider treating that condition about an exercise regimen. Diet is also, good evidence is hard to come by, right? So there are no kind of huge definitive studies on do this, do that. Although I think in general, there is good evidence for kind of anti-inflammatory diets in a variety of conditions. That includes chronic mental health conditions, that includes chronic pain conditions, chronic medical conditions. And in general, kind of the most accessible shorthand for that is like a Mediterranean diet. It is kind of a good anti-inflammatory diet. So those are the two things I usually start with folks. Some of our medications, our psychiatric medications, do double duty. So they're also used by pain providers. One of the most common classes are called SNRIs, and that stands for selective serotonin and norepinephrine reuptake inhibitors. The common ones we use are venlafaxine, which has a trade name of Effexor, and duloxetine, which has the trade name of Cymbalta. Those have FDA indications for depression, neuropathic pain. So those are frequently used, and it's kind of a very useful thing for both me as a psychiatrist and providers that are treating pain. Tricyclic depressants also have that same, tricyclic antidepressants also have that same sort of efficacy, helping with depression and helping with neuropathic pain in particular. In terms of therapy, again, it's a little bit like diet. It's hard to get really good data. Cognitive behavioral therapy has been the most studied and has the best evidence for pain, but there are other therapy modalities that are showing some usefulness, in particular, like relaxation, mindfulness therapies, and there are other components to the therapy piece as well, with regard to kind of socialization and social connection, which we'll get to in just a little bit as well. The main pitfalls to watch out for when treating mental health condition, to watch out for drug interactions. So if somebody is taking Tylenol, if somebody is taking a nonsteroidal anti-inflammatory, those can have impacts or interactions with psychiatric medications as well. So all the providers need to know kind of what medication someone's on. And then obviously watch out for substance misuse. This can be in two different ways, right? So if somebody is on opioids for chronic pain, we need to watch out for misuse of that medication. Likewise, if folks have chronic pain and anxiety and are not working and start to drink, we need to be attentive to the potential to develop substance misuse. So psychiatrists love the biopsychosocial model. We kind of say it all the time. I think this is just a helpful way for us to keep in mind that we're not dealing with just one thing. So pain outcomes are kind of the intensity of pain, the duration of pain. Is the pain better or worse? What is it on a scale of 1 to 10? There are physical manifestations of this. So there's disability, sleep disruption, the psychological outcomes of this. So depression, anger, irritability, anxiety. But kind of sitting in the middle are the social outcomes. And I think we often overlook that. And that can be kind of the loss of somebody as a breadwinner in the family, the loss of being at a job and having that sort of interaction, the withdrawal, the loneliness, the not doing the activities that they used to like to do. And these all play a role and something that we have to consider when we're looking at kind of an individual person in front of us and what they're going through. So in terms of practical things to do, I think the takeaways that I would say are these two things. So chronic pain and and mental health are highly related, and they often overlap in a large number of people. We need to treat the mental health conditions. There are a variety of ways to do that. And the ways that people can do that on an individual basis, or the ways that employers or caregivers can support somebody with these struggles, is absolutely to keep track. So there are all kinds of apps with sleep log, mood log, pain log, and then to give this data to their providers. So it's a very different thing to come in and say, I'm not sleeping. Can you help me with that? It's a different thing to say, like, okay, I've taken this journal for the last 2 weeks. Here's how many hours I slept. Kind of, maybe I had coffee too late on that day, maybe not this day, but that is useful and allows us to make kind of good decisions. So it also gives folks kind of some ownership over, some empowerment kind of over their conditions, something they can actively do. And I think going back to that biopsychosocial model, also kind of therapy and group therapy, social connection and social support have good evidence for, if not improving kind of pain on a pain scale, improving more global functional measures. And this is true for patients, but also caregivers and loved ones of folks that are struggling with this. And then finally, I included something I use often with folks. So, okay, we started this med, it's not going to work for 6 to 8 weeks. We signed you up for therapy. There's a 6-month wait list. Mindfulness-based stress reduction started at Harvard and has good evidence in kind of the reducing stress. They've then used it for chronic pain. They've looked at it in mental health conditions as well. And it was originally designed, I think, as an 8 or 12-week course. You would go there, you get the certificate. There is an online version on that site that's self-directed, and it's free, that folks can just start tomorrow. One of the reasons I like it is they do a lot of the like relaxation, mindfulness, and kind of acceptance therapy type interventions, but they do a wide range of it. So they would do like a guided meditation, a body scan, a moving meditation. So folks can try different things and identify for them what helps reduce their stress, what helps them kind of forget about their chronic pain for a little bit of time. So it's an easy thing to give folks that they can try right away. And I think that's it for me. I'm looking forward to questions and answers at the end.
Thank you so much, Kristen. Great presentation. And I think it's a great lead into our next speaker, Melissa Emmons, who's really going to build off that and share more strategies as well as information about programs right in here in Maine to support patients with chronic conditions. So thanks for joining us, Melissa.
Yes, thank you, Karen. Happy to be here. So as Karen mentioned, my name is Melissa Emmons. I'm a community programs coordinator at Maine General's Peter Alfond Prevention and Healthy Living Center and the Community Health Department. I'm a health educator, and I'm also a certified health and wellness coach. And I coordinate and lead programs and classes that are specifically focused on disease prevention and management. And one of the programs I lead is called Living Well for Better Health. It's a program that's specifically designed to help people better manage chronic conditions. So that could be anything from heart disease, arthritis, diabetes, asthma, emphysema, and many of the ones that Bree mentioned on her slides. It's really any ongoing health condition. And what I'm going to do today is share with you briefly some of the ideas and the tips from that program. And then I'll also talk a little bit more about the program itself and how you can enroll in that program if that's something you're interested in. So I love this quote that I took directly from the program because it really emphasizes that healthy doesn't mean being absent of health issues or disease. Right? We can still live a healthy life despite having a health condition. And the key to that is really to decide to actively self-manage, to be actively involved in the day-to-day management of your condition so that you're living the healthiest and best life possible for you. I had a participant share that just reading this section of the book was life-changing for her. She shared that for years, she'd been trying to cure herself of her chronic condition because she didn't realize that it wasn't curable. So she continually felt like that she had failed. And she shared that now that I know it's something that I live with, and the best that I can do is learn how to manage it to be as healthy as I possibly can be. She said, well, I can do that. And she really wished that she had been told that years ago. So as we've mentioned, there are many different chronic conditions, and there are some differences among those diseases. But many of the challenges, many of the symptoms associated with living with a chronic condition are similar. So that means that the self-management skills, the tools that I'll share with you today and that are a part of this program, can help people no matter what the chronic condition is that they're managing or living with. And in fact, the tools that I'll share with you today and are part of the program are good not just for people managing a chronic condition, but are really just good tools for anyone who's looking to take control of their health and to live healthier. So I want to start by talking about 3 key self-management tasks. The first one is taking care of your health condition. So if you're taking care of a health condition, you are likely following some type of treatment plan that you've decided with your provider or providers and your healthcare team. You've seen your provider, they've given you direction on how to manage your condition. Taking care of your health condition also means it may mean taking medications, it may mean eating healthier or following a specific diet, it may mean getting more exercise. It's also important to ask questions, right? So ask your provider and your pharmacist questions. And then also share with your provider, as Dr. Sparks mentioned, journaling might be helpful or some way of keeping track. Keep track, monitor the things that are happening between your visits, and share what's happening with your provider when you see them for your appointments. You should also be sharing with them things maybe that were part of your treatment plan that you're not doing, and talk about some of those challenges. Why aren't you doing them? You, as the patient, are the most important member of your healthcare team, and it's really important that you share with them what your preferences are, what are your goals for your health, and also share those things with your family and your friends so that they can continue to help you as well. The second task is carrying out normal activities, and that really just means continuing to do the things that are important and are meaningful to you. This could be continuing to work, spending time with your family and your friends, doing the things that you enjoy. Now, depending on the symptoms of your condition, carrying out some of these activities may become more challenging. So it may mean needing to make changes or just finding new ways of doing those activities. But the most important thing to do is to find a way to continue to do them. And the third self-management task is to manage your emotions. Oftentimes, when managing a condition, we might experience emotional changes. So maybe we're angry, or we may certainly feel frustrated. We can't do the things the way we used to do them. We may have uncertainty about the future. Just know that these feelings are normal. They're a symptom like fatigue or pain are as well. But it is important to be able to recognize these feelings when you're having them, and then also have ways of dealing with them that are healthy. So some ideas might be going for a walk, journaling, just getting outside into nature, calling a friend, maybe doing some deep breathing. The better you are able to manage those emotions, the more you may be able to keep other symptoms under control and ultimately better manage your condition. Now, I recognize following these self-management tasks isn't always to do, especially when we're managing a chronic condition. It also may be challenging to follow that treatment plan that includes making healthier food choices or increasing our physical activity, right? Those things aren't always easy to do. Or you may be questioning whether or not you want to start a new medication that your provider's recommending. Your condition may cause you pain or fatigue, so carrying out normal activities can be challenging, even if you want to do them. But there are several tools that can help us to carry out the self-management tasks and these other tasks to help us live our healthiest life possible, whether you're managing a condition or you just want to be healthier. The first two listed here, Dr. Sparks also spoke to. So the first one I'll touch on is doing physical activity. It is one of the healthiest things that you can do, all of us can do for our overall health. And the general guideline for all Americans is to get at least 150 minutes of physical activity. That averages out to about 30 minutes a day, 5 days out of the week, but you can break that down into smaller increments. And moderate activity just means getting your heart rate going a little bit faster, breathing a little bit heavier. And one way to tell if you're working at a moderate intensity is what we call the talk test. And what that means is you should be able to carry on a conversation, even if you're working at a moderate level. But if you're working so hard that you can't carry on that conversation, you're working at a higher intensity than you need to be, and you might want to decrease your intensity. However, if you're able to sing a song while you're doing that activity, you might want to increase your intensity a little bit to get more of that aerobic effect. Part of a good physical activity regimen or program also includes doing exercises to increase strength and also stretching to maintain or improve flexibility. Healthy eating is also very important to our overall health and wellness. Healthy eating means eating a variety of vegetables, fruits, grains, lean meats, fish, nuts, seeds, and maybe some dairy. And two ways of eating healthfully include the plate method and, as Dr. Sparks mentioned, the Mediterranean diet. And both of these ways of eating focus on eating whole foods, so lots of vegetables and fruits, primarily whole grains, protein, and some healthy fat. Also helpful to managing a chronic condition is getting a good night's sleep. Better sleep can help to improve many chronic physical and mental health conditions. It's important to make sure that your sleeping environment is comfortable for you. So making sure it's a comfortable room temperature, you have a comfortable mattress, a comfortable pillow. It can also be helpful to follow a bedtime routine consistently so your mind and your body know that you're preparing for sleep. It may mean getting to sleep a little bit earlier than normal. And it can also be helpful to go to bed and to get up at the same time each day. Also helpful is taking medications as they've been prescribed, so maybe that's in the evening or with a meal or a full glass of water. It's also really important to communicate with your provider if you're not taking your medications either as they've been prescribed, for example, maybe cutting them in half, which isn't advised, or if you're just not taking them at all. Make sure to share that with them. Using your mind to help manage symptoms of pain, stress, and fatigue. You'd be surprised at how powerful the mind can be. Things like guided meditations, body scans, and there's lots of other mindful distraction techniques. They can really help to manage a number of symptoms, and recommending checking out the resource that Dr. Sparks shared. And then also using good communication skills. So that means with your provider as well as your family and friends so that they can help support you. So that means being honest with your providers about what you are and what you aren't doing to manage your health and how things are going. Being open and honest with your entire healthcare team, so providers, pharmacists, nurses, by giving them the information because they need that information to best help you manage your health. Utilizing problem-solving skills. So there might be some challenges with managing your condition, and problem-solving skills help us to come up with solutions to overcome some of those challenges so that we're able to carry out the tasks that we want to do. And then creating action plans. That may be one of the most important tools we have. So creating an action plan just means creating a small goal to help you make progress towards taking action and managing your condition and accomplishing your goals. And all that I've touched on today, the self-management task, all the tools, they're covered in a whole lot more detail throughout the program, and there's lots more great group discussions if you participate in the Living Well for Better Health program. Just to share a little bit more of the specifics and structure about that program. It is an evidence-based program, which means it's been researched, it's been proven to be effective at helping people to better manage chronic conditions. And the program was developed out of Stanford University and is run by the Self-Management Resource Center. It is a 6-week program that meets once a week, and it is led by trained facilitators. And the program is offered a variety of ways. It's offered in person, virtually, as well as telephonically. When the class is held in person and virtual, it's a 2.5 session for each of the 6 weeks, 2.5 hours. And then for the telephonic program, they shortened it a bit. It's just a 1-hour session. They're both great options. The 1-hour session, it's a little bit more self-paced because you don't have as much time to dive into all the content and all the information, but still a great option. And with the virtual and the telephonic programs, materials are sent out to participants in advance of that class start date. So everyone starts with the materials in front of them, and then the group discussion is led either virtually or by phone. Now we offer this program through Maine General, but it's also a program that's offered throughout the state of Maine by several different healthcare systems, as well as some community-based organizations. And the program is offered at no cost to participants, so there's no cost to participate in the program. If you are interested in the program, there is a community care hub called Healthy Living for Me, and I've shared their website there. Any of the organizations that lead this program and others are encouraged to list their classes on the website. So you can go right to that website, you can view the current class offerings, and you can also register for classes directly through that website across any of the organizations that are offering it. Lastly, I just want to quickly mention that in addition to Living Well for Better Health, there are similar programs. One is Living Well with Chronic Pain, and the other is Living Well with Diabetes. They have the same structure as the Living Well for Better Health program, but as might be implied by the names of the programs, the content varies a little bit depending on the specific focus of the program. Chronic pain has more emphasis on talking about how to use the mind to manage pain, and we talk a bit more about medication and such. In diabetes, when we talk about healthy eating, it's a little bit more specific to healthy eating for diabetes. And we also, as you might imagine, talk a bit more about preventing complications and monitoring blood sugar levels. Though both of those programs are also offered statewide and are also listed on that Healthy Living for Me website.
Thank you so much, Melissa. I actually went onto the Healthy Living for Me website and encourage folks to do that. I was amazed at the number of programs that are listed there and offered to folks throughout the state. And it's a great resource, not only for our audience, but for them to share with their loved ones, colleagues, or employees. So highly recommend visiting it and checking it out. And thanks so much, Melissa.
Yeah, many more programs than I even spoke to. So definitely check it out.
Yeah, absolutely. I am pleased to move into the question and answer segment now and encourage folks to use the question and answer feature to ask questions of our panelists. And at this time, I'll ask all of you to just turn on your cameras and we'll have a conversation, and I'm looking forward to it. And I'm going to start with you, Bree, because there was a question in the chat about just the shortage of pharmacists and a curiosity as to whether we're seeing a similar shortage in the field of pharmacy as we are in other specialties. And I'll also tag onto that question about the what is the ambulatory pharmacy a field that is grown to the point where most people would be able to gain access to that resource?
Yeah, both are great questions. It is predicted that there will likely be a shortage of pharmacists coming as well. Enrollment in pharmacy school has been steadily declining over the past few years. We haven't really seen this affect Maine too much yet, where we still have 2 pharmacy schools here, but it is a concern for the future. There's definitely been burnout within pharmacy as well, and our retail pharmacies. So it's definitely something that we are thinking heavily about in the future. And in terms of kind of the access to ambulatory care pharmacy, I'd say it's still new and evolving. It's been expanding, at least within Northern Light, since I've been here, and we're continuing to grow that program. But I think for my presentation, you'd walk away and saying, well, why doesn't everywhere have an ambulatory care pharmacist? It sounds so fabulous and so helpful. But the biggest challenge that we face with expanding services is reimbursement for the services that ambulatory care pharmacists provide. Until we're really recognized with a provider status, the reimbursement just isn't there. And so that's challenging, that if places want to include an ambulatory care pharmacist on their team, you have to get creative about your business plan and your approach to that. And that's why this kind of shift to the value-based payment models is really great, because the more we can shift to a place where we're trying to reward good quality care, that lends to having an ambulatory care pharmacist on the team who can help increase reimbursement through that avenue.
Great. Thank you so much, Bree, for giving that insight. There is also a question that I'll toss out to you, Melissa. It's asked if we want to train staff at our hospital to provide the Living Well classes, how does one go about becoming trained and becoming a site for that?
Great question. So yeah, you can reach out directly to that healthylivingforme.org. They are the license holders for those programs, and they offer trainings. They have master trainers on staff. Like I said, they're a community care hub, so they're representing and programming across the state of Maine. So I would just either call, or I think there's an email address on there. They actually also, I don't know exactly the link on the page, but you can go and view upcoming trainings as well. So yeah, I would just reach out directly to them. It's a great group of people there.
Thanks, Melissa. And I have no doubt, having worked with Melissa just a short time, she's happy to answer any questions as well, to help navigate that.
Yes, of course.
Yeah.
Yes, please do reach out. I'm happy to help.
Thanks, Melissa. I will actually follow up with you because I believe that this is part of the curriculum for the Living Well program. And I'm sorry, I know it is still Living Well. Okay. I used to be an instructor, and I know a lot changes, including names. But what strategies can be used to enhance adherence to a chronic disease management plan? Because I'm sure you see in your classes, patients become, victim to some, routines or life challenges. And so what helps increase their likelihood that they'll be able to be successful?
Yeah, good question. And we definitely talk about in those things in that program. So one I spoke to was the kind of the problem solving steps, and I didn't go into detail on those steps, but it really is just about identifying the specific challenges and then coming up with a list of solutions for them. A couple other things come to mind, and Dr. Sparks kind of spoke to this as well, is about getting support. So, if we're doing it on our own, trying to, put these things into effect in our lives and take action, it's harder. What I find is a lot of times people, what they appreciate most about the program, of course, is the content and the tools that we're giving them, but it's also really just being able to connect with other people, particularly with the chronic pain program, just about they're connecting with people who often are experiencing some of the same symptoms and challenges that they are. So there's a lot of sharing. So I would encourage people to get support. And then the action planning. So action planning, I mentioned, is one of the tool, and it's creating one small goal. We ask everybody to pick one. We do it at every session. So for each of the 6 sessions, we ask people at the end of the session to create a goal, one small thing that they want to accomplish in the next week. And there's some accountability to that. So I think, you can action plan yourself. It doesn't have to be in a group setting. But starting small, pick one thing that's going to help you make progress and start there and look to be doing that consistently.
Thank you so much. That's very, very helpful. Dr. Sparks, I'll ask the next question of you. And I kind of have a couple that are bubbling, so I'll try not to blend them and confuse you. What are some of the signs and symptoms that caregivers or loved ones or even colleagues might be on the lookout for that might indicate somebody is struggling with a mental health diagnosis?
Yeah, that's a great question. And you know, our field, you know, we can't get an MRI and diagnose something. We can't always get a blood test and diagnose something. So it is a lot of kind of signs and symptoms. Um, Oftentimes people around folks struggling with mental illness kind of can appreciate it before the person struggling themselves does. So it's really relevant to have people around them kind of know what's going on. Um, Most often it's a kind of a noticeable change in behavior. So it's often withdrawal, it's often increased irritability. It may be not attaining kind of or attending to responsibilities that they usually would. You know, just any of that sort of social fall off where, you know, every time I call them, they call me back or at least text and say, we'll talk later. And I haven't heard from them in 2 weeks. Or usually if they're going to call out for work, you know, they call me right at 7 a.m. and let me know what's going on. But this was like 2 days of no show, no call. Just those social changes that are unexplained based on the prior behavior. Because oftentimes, you know, there's a huge stigma around mental health still,
Right.
and people have a hard time saying like, I'm really struggling. I'm struggling with depression. I'm struggling with anxiety. This project at work has me so anxious I can't even function. So it'll be those failure to attain kind of their usual social roles that often people see first.
And as a somebody who's recognizing that, is there any advice that you might give to folks on how they might help direct or support that individual to get help?
Yeah, I think, you know, the first part is just being kind of open and honest and asking, you know, how are you doing in a way that's not, hey, how's it going? Hey, how are you? But sitting down over a cup of coffee and like, how are you? No, no, really, how are you? Often it helps, especially kind of in that peer or kind of in that social setting, to normalize things. Like, you know, I know my brother struggled a lot with X, Y, and Z, and I've had this, that, and the other happen. Just opening that conversation up. Then in terms of seeking help, you know, there are, I guess we're now getting into like there are a lot of different areas, right? So if it's within a corporate structure, there's often kind of EAP, so the employee assistance
Right.
programs that are a really good way to direct to. Primary care is often the first kind of entry in. If things are kind of scary, dangerous, might need more urgent, then 100% kind of emergency department visits. 988 is a national suicide hotline that just went live last year, that you can text or call 24/7 if it's something that urgent. And going back to the shortages of pharmacists, providers, all kinds of people, you know, there are astounding wait lists to get psychiatric care on an outpatient
Right.
basis and to get in-person therapy.
Right.
So trying to utilize those other methods often gives you better luck.
Yeah, I love that. And so I think it's just so important for us to understand what resources are available in our EAP, for instance, and it was 988.
988.
Yep. So thank you so much for that, Dr. Sparks. And thank you all for joining us, and a special thank you to the panelists. You can find recordings of all of our Zoom conferences, including today's, on our Northern Light Health website. And I hope you have found this hour to be helpful in support of you and your employees in our communities. And just a reminder, we will be emailing you that survey. We'd love to hear your feedback. It has been my pleasure to be part of today's conference and to have spent the last hour with you all. So thank you and have a wonderful afternoon.